Hi everyone, this is Meenakshi Ramesh from tapyawaytohealing.com. Today is April 10th. You'll be watching this video on April 10th. We are doing a recording with yet another guest today. And as we are honoring neurodiversity and autism this entire month, I have my dear friend Rajeswari Vattyam here with me. She is a speech language pathologist. So before we start conversing, before I ask her questions, I'll quickly read her bio. Rajeshwari Vattyam is a speech therapist working for South San Francisco Unified School District in the county school with students with severe speech language deficits and autism diagnosis. She also works in a home care agency, Asian Network Pacific Healthcare, working with adults with neurogenic deficits causing speech language and swallowing disabilities. Raji has 25 plus years of experience working in different settings, be in private clinic, nursing home, hospitals, home care, and schools. Raji graduated with an undergraduate degree from All India Institute of Speech and Hearing, Mysore, India, and completed her master's from St. Louis University, Missouri. Raji's professional goal is to strive to improve functional overall communication skills, be it for adults or children, and to educate caregivers and parents to help achieve this for them. Raji has also presented in ASHA, American Speech and Hearing Association, and her areas of expertise are working with adults with stroke, Parkinson's disease, dementia, and other neurological disorders, working with children with autism, language delay, speech deficits, including apraxia and articulation deficits. Raji's hobbies are singing, dancing, painting, cooking, and traveling. Welcome, Raji. Thank you for taking your time and doing this for my channel. Raji is a very good friend, and she was my son's first speech therapist. So that's how our relationship started. We go way back. I know Raji for nearly 2 decades now. So now over to Raji. Raji, just start. You can start off your this presentation or conversation with your experience working with individuals on the spectrum.
Thank you, Meenakshi, for having me here today and to talk to your viewers about my views on autism and what I have done and what can help individuals with autism. Um, and our friendship has grown in the last 20 years. And it was really nice that I could be your son's first speech therapist. So, anyways, talking about autism, I know it can be quite challenging for the parents, to let go when they receive this diagnosis, and then they feel like, oh, what do I do? Where do I go? What can I do about it? I know it's challenging because the individuals, children with autism, can present a wide spectrum of deficits, right? Be it behavioral, they could have feeding issues, they can have speech issues, cognitive issues. It can be the whole gamut from pretty much very severe to maybe mild, right? My main thing is, even before actually a person gets diagnosed as being has autism, I want to stress the importance of early of identification, right? Getting the diagnosis, getting them seen by the MD to diagnose what is the condition, what is going on with the child, right? Because especially the earlier they do get this diagnosis, it's faster for them to get the therapy versus just being at home and thinking, oh, my son or daughter is a late bloomer. We have this in the family where we speak, everybody speaks in much later. Please err on caution and get get seen by the MD or a pediatric neurologist. Many times I say the mother's intuition is right. The moms know when something is not right or something is amiss with their child. So don't put that aside. Okay. So now, moving on, now that we have we have the diagnosis, what do we do about it? So one of the main things is to seek out help. And mostly the children will need more than just one speech therapist. Is just part of a team. of a lot of people who will be needing to work with your child. The child might need occupational therapists to work on the sensory needs, may need a behavioral therapist to work on the behaviors. And so speech therapist is one cog in the wheel. So we should work as a team, and it's most effective in
Yes.
terms of the intervention.
Mm.
And also the main role in this is that of the adult, of the caregiver or the parent, because you spend the maximum time with your child and you know the child best as to, and especially with even with the assessment tools that we have, especially early on, is basically almost like an interview that we take from the parent. So we have a lot of questions that we'll ask the parent as to how does the child communicate? Does he point? Does he lead you to the objects? What kind of noises does he make? Can he say some sounds? Can he say some words? Because many times these children don't perform, in terms of in front of a stranger. They have stranger anxiety. Uh, so so having said that, it's important for you to relay the information to the professional, be it the speech therapist or any others in the team, as to what you're seeing with the child. Now, having done that, now as a therapist, what the therapist can do is give some professional opinion as to what they think is a good strategy to work with your child. Maybe the child is better with is a visual learner, or is he good just by hearing things? Is he auditory learner, or do you have to do both? Is he good at gesturing? Is he, should we use that tactile sensation as a means to communicate? Sometimes he might use more than one means to communicate. But whatever it is, that has to be reinforced at home. For example, my goal is actually to bring about total communication. I keep stressing it to everybody, be it my children, the students, or adults, that the goal is total communication, be it verbal. Verbal communication is just one part of communicating, isn't it? So we can still communicate with our gestures, with our facial expressions, with simple hand signing, with pointing, right? So speech is just one part of it. So can we focus on that? And then for many kids, especially with autism or any, they have a hard time coming up with the words. But then if we keep pushing on it and not give them an augmentative device or something to augment that, they can be very frustrated. It can be very frustrating for them. It's almost similar to, I would say, let's say an individual who needs to wear glasses. I see Meenakshi is wearing her glasses. Now, I will tell her, now you remove your glasses, but I still want you to see. It's not possible. She needs those glasses to see. She has a disability. She has a vision deficit, and that is corrected with her glasses. The same thing, right? If you have a difficulty speaking, you cannot think of words, or you cannot say it, and we don't give them another means or anything to augment or to help them and assist with the communication, it's going to be very frustrating. And then you end up with behavioral issues that you see a number of times with
Right.
individuals with autism. So
Right.
we
So,
have to.
so, so I just want to pause here for a minute, and I just want to highlight on two things that you mentioned right now. One is, the behavioral. When they get when their communication is challenged, then they end up having behaviors. And having done ABA and a lot of behavioral support for my son, I know that any behavior is communication. So every time the child has a behavior, the child is obviously trying to, child or individual of any age, they're only trying to convey something to you. So that's something that I'm glad that you shared that. And also I want to circle back to what you shared about communication. Just when we talk about communication, we are not just talking about only the speech. We are talking about very many things. And when you mentioned that, about the bodily gestures, the signs, and facial, the gazes and eye movements and all that, I feel that that can make a huge impact on any individual who is on the spectrum, because they can, if they are, especially if they are a visual learner, if, when they look at you, they can just embody that experience, even though they may not be expressing it. It helps them understand those emotions and
So
be
true.
understand social, to develop a social understanding as well. Yeah, yeah,
Yeah. I mean,
yeah.
it is, I mean, that's why it's important, I feel, especially, when they're young, right? Even they may not have many words, right? But they should be taught like simple, like signing, like stop, more, you know,
Yeah.
that kind of in yes, no signing, because that can be helpful in many ways. Let's say the child is really overwhelmed and they're, before they have a burst out in a behavior, they can just use a stop. They can say stop, or they can sign stop to say that, I'm done, or I'm all done, to say that, let's, so they can, instead of having a explosive behavior there, able to communicate that I'm all done here, I need to get away. Then the person can understand that, okay, this is, let's give them a break. And, instead of just keeping at it, and leading to, so it's important for them to, to be taught these, simple signing or simple words, even single words that they can use. And it has to be taught not just in one context, but in more than one context, that they can be modeled. First you should model it to them so they understand, okay, this is when I say, do you want more? You want more cookie? Then yeah. Then you say, okay, then maybe another place, do you want more of the TV? That kind of thing. So not just for the cookie that they know more, or not just for food. Maybe in other situations as well. And maybe other members in the family also should use the similar, the same, words with them, so that it's kind of generalized more, and not just with that one person, because they tend to think, oh, only this person can use these words with me, and maybe not another person. So let's and have more than one, everybody in the family can use it, and it's easier for them to generalize it. And before you know, they will start using the words. There's more, they're being bombarded with these words and with the signing, along with the words, they'll start saying it, you know. Yeah, and also maybe for some individuals, they might need pics, like a symbol that they can point. And also offering choices is a good example, right? Because they may not be
Right.
able to say what they want, but they know what it is. You can say, hey, did you, especially if they're wearing clothing or something, they just, I don't want it. They're just throwing it away, and they kind of, then oh, this is not what they want, right? They're expressing it. Then you can give them an option. Do you want to wear this or this? Show them, you want to wear the black shirt or the red shirt, and they can choose what they want. You're given a choice, will help them also enable to communicate. And whenever they do something, positive reinforcement, when they're actually making a choice or saying what they want or pointing to what they want, everything they're communicating, right? You give them a lot of positive reinforcement for doing that. So that also will reinforce the fact that, hey, I am communicating, I'm getting positive reinforcement. It could be maybe things like a snack, that they like popcorn. Maybe they get a kernel of popcorn, maybe not a whole bag, because you want them to eat it all in one go. Maybe you say, hey, you, you did good, or you get this, or you get maybe some time, time on the iPad, or, whatever it is that they like, right? So that, and, but they should understand that, that you do this, and that's why the consequences, you have done this, and then you've earned this reward. So that really will go a long way in, in terms of, even reinforcing what they've learned, and plus, encouraging them to use, to communicate. Um,
So anything else you want to add, Raji, before I go on to my next question?
So in terms of, the other thing, I know we had talked earlier was about feeding, right? Yeah,
Right,
Meenakshi. So
right.
yeah, so that's another area that, many of the individuals on the spectrum can have, problems with feeding. That's again sensory. They may not like any sensation of the any kind of texture in their mouth, and they may just spit it out, or they may not want to chew it, just holding food in their mouth. The individuals who do work, with this would be a speech therapist or an occupational therapist. So it's important that you reach out basically like anything, you got to desensitize them to
Mm.
textures, and it's done in
That's right.
different ways, like maybe like massaging the gums, using like a
Mm.
vibrator toothbrush off, and kind of starting from outside and slowly getting into the gums, and maybe massaging, and then then slowly starting with foods which have some texture, or even putting food in like a bag, like
Mm.
a poultice bag, and then having them chew on it, so
Mm.
they kind of get this thing of it, they're actually chewing on something, and they know they won't choke, they won't choke because it's in a bag.
Mm.
And then that kind of thing, and slowly graduating them to maybe more chewables, different ways of doing
Mm.
this. Again, there's no one approach to everybody. Each
Mm.
each individual comes with their own
Mm.
set of problems that and is dealt differently
Mm.
based on what is it what is it that they're exhibiting.
Expecting.
Yeah.
Yeah.
So it's important to reach out, and don't just think, oh, he might outgrow, and just keep giving them milk, or
Mm.
like things like that,
Mm.
because there is a time for everything, right? You want to slowly start working with them on this before they're like
Right.
10 years old, or like 6 year old, or they're still only drinking
Mm.
Ensure and drinking blenderized food or eating like that. You don't want to take away that from them, because
Right.
eating is a pleasure, right? It's something we all look forward to eating, and that's something we can gain pleasure from.
Right, right. There
And
is, yeah, it affects the quality. It has a huge impact on the quality of life of the
for
child and the
sure.
entire family,
Yeah,
because there is a social component
yeah,
involved, when it comes to
definitely.
food. And I have actually taken my son for feeding therapy sessions with Raji, and she helped my son, and it made a big difference in terms of his chewing and eating and swallowing, food. And meal times have became more pleasurable. Was a pleasure after that, after those sessions, because it gave me as a mother, it gave me the confidence that he has we can improve, expand his food choices and
Yeah,
not
the repertoire
limit
of food
himself.
that he can eat,
Yeah,
right?
yeah,
And also
exactly.
as a mom, and also as a we provide, right? As a
Yeah, yeah,
provider, like you feel
yeah.
like, oh, I cooked this food and he's
Good,
enjoying it.
enjoying it.
That also
Yes,
gives a person joy, right?
right,
He enjoyed
right,
it, he ate it.
right,
Versus if you're not
right,
able to, the child is not able to enjoy the food you made, then
mm,
it's kind of, it's sad also, you feel bad about it that he's not enjoying it, and there's something that you feel about it too.
right.
So yeah, at different levels, and emotionally too, right? It affects
Yes,
everybody.
yes,
And
yes, definitely. So we talked about early intervention. You shared about um, how the therapist work as a team. The speech therapist is part of the team, and speech is not the only thing. It's the communication that we are focusing, and we talked about different elements of communication. um, I want to I want your input on technology, because I feel so much has changed in the last 2 decades. There is so much technology that everyone is using, including if you see a 6 month old child can knows how to operate a smartphone. So, and it's very friendly. Technology is very friendly, especially for individuals on the spectrum. It can make a big difference. It can be used. It can be it can work against them also if they're doing too much of it. Could you talk a little bit about how technology can help individuals on the spectrum, especially in terms of speech and communication?
yeah, there is a lot that's so true, but now everybody knows even a 6-month-old
Would thought
can handle a lot of devices that we never thought
effectively.
we could when we were
Yeah,
that age.
yeah,
But having said that, technology may not be for everybody, right? Again, there's also low tech options, like a communication board and just
yeah,
pictures, and then showing, because if a child or an individual has a lot of behavior issues, and they're throwing the devices, or and it breaks the minute you throw it around, then for those individuals, maybe buying into a very expensive, because these devices are expensive, may not be the one, may not be the right thing. However, if individual can use it, yes, there are a lot of devices out there, which are voice activated. They can be like a Go Talk, Dynavox, or there are all kinds of companies out there. And the AAC specialist or a speech therapist who has AAC certification, is a person who would actually best guide you as to which technology works best for your child. Because again, technology may be there, but again, you have to assess, can this child or this individual use it? Because sometimes you may have many boxes or things on a screen. It can be very challenging for somebody who has decreased attention span, or could to actually scan all those different objects, those boxes, and to pick the right one. Or so it has to be, the device has to be chosen based on what individual or each child can do, right? And then, having said that, once it's chosen, and again, either the AAC specialist or in conjunction with a speech therapist, you can determine what are the key elements that you want on this board, right? What makes sense to have on this board. Uh, and then once that's decided, the child needs to be trained, the individual needs to be trained to use, right? And use it in more than one context, not just in front of the speech therapist. So it's good that they have this device sent home, so the parent can work with the same device. I currently work in the county with the county students who are much more on the severe range, and many of them are nonverbal. And some of them have had devices for years. However, because the carryover may not be that good, they're still struggling with, or they're struggling with actually using it, or they only use it in one context, not in other contexts. So it's important that it needs to be generalized across, right? And the other thing is, especially with the adults, with the adult individuals who are nonverbal, or who don't have that many words that they can communicate with, having these devices is a big help. Many times the family may feel like, oh, I can understand what they're saying. They can point, they can lead me to it. However, the family may not be with them always. They may end up, they may be going to a group home, or they may be going to an adult center. So the goal should be, as a speech therapist, my goal is to tell them that, hey, you may not be there with them all the time. However, there may be other caregivers or other people that this individual may need to interact. How is the person going to interact if they only have limited words? How can they interact, right? So in those cases, it's important, again, to use a device, or you even use a low tech device, for them to communicate their needs, right? And again, going over with the individual and the family as to what are the things that they like, what is it they want on it, what does it make sense for them, is what is important, and then training them with it.
Right, right.
But in terms of specific devices, yes, there are many out there. Again, what works best for an individual is something that needs to be assessed and then determined, as a team with AAC and the speech therapist and the parent. Yeah. And also the OT. Many times, maybe they may even have a limited usage of their, they may have a lot of tremors, or they may have movements that can actually make it hard to navigate the small keys on it, right? So it may take more than one member in the team to come up with it, a good solution.
Right, right. And I really like that you spoke about the low tech option, because myself and a few of my friends, we've worked in the school district with children on the spectrum, and we used to have like a whiteboard, and sometimes even with preschool children, we would write or draw something on it and then show them to point, and children who can point, they will point. And whether they get it right or wrong, some initially it may be like they're confused, but then with more repetitions they'll get it, and then we would increase the number of choices on the board itself, on the whiteboard.
That's
And
the right way of doing it.
yeah, and
Don't
I love low tech and giving choices. Those are two my go-to options even now, even till today for my son, because it's because of their sensory overload, overwhelm, and processing issues. Sometimes it's you have to downsize, to give them a few
exactly.
choices so that they can come up with an answer and not get lost, so that it encourages them to continue with the conversation and contribute to in any situation. Yeah.
I totally agree with that.
Yeah.
Because the more things are out there, it can be very overwhelming. And even for them, right, in terms of the routine, right, I
Right.
also, to want to even get them back to what we're doing, I say
Yes.
first speech. And
Mhm.
even in that,
Yeah.
drawing what we're doing in speech, maybe first we're doing, yes no questions, then we're doing maybe pointing, even writing that, and or putting icons or drawing on the my board, saying first we do this, then this, then you get the reward. Maybe it is Play-Doh time, or maybe whatever it is, or Kinder Egg, whatever it is that the individual likes, they want to do, having that first and then boards. I'm a big fan of that. And that really seems to help with also with the behavior. So they know that this is the time I
Yeah.
do it, and then I get it. Or even for some, I've found even like the timer, setting the timer,
Right.
and say,
Yeah.
hey, the timer goes off, you get a break, and then we are done. Or no, you go get a break, come back, maybe a 5-minute break even, come back, and then we resume what we're doing. And then we set the timer back on again, versus having a whole 30-minute session or 45-minute session, which might seem endless for them. It's, you have all these behaviors come out because there's no way
Right.
they can sit for that long. Many
Right.
of the children or individuals with autism cannot take that long sessions. So it
Right.
may be good to give the breaks and come back. And I found that much more better in terms of for them to participate. Increases their participation in speech by doing those things. And they can do the same at home too. You're doing these activities. The thing is, whatever we're doing in speech can be done at home too. The same things can work. Because if you do the same reinforcement, then it'll be like, oh, they're used to this. Oh, first I do this, then I do this. First you sit, and do this puzzle, and then you can watch your iPad. The same things can happen at home. The playtime too, so they know that you can't just be running around, and doing different things like at the same time, right? You finish this and then you can do this, or yeah. And the other thing which I find, which is very important, which I find in terms of communication, is simple yes no. Yes no is a very very simple question, right? You can ask anything pretty much in a yes no format. I find it not just with the autism individuals, even with my stroke patients. Yes, no is a great tool to communicate, you know. So I would encourage everyone to work on the simple yes, no. Always start with, is your name, let's say, your Adam, right? Let's say, is your name Adam? Yes, no. Maybe do yes, no head nods, or just have icons, yes, no, that they can point, or even yes, no, if the child is like, yes, no. So they kind of, whatever it is that the child is using, if he's using signing, basic signing, you can do it along with it. Yeah. So that becomes more concrete. Always start with what they know. The name, if they know, start with the name. Yes, no. Then you are kind of throw in, is your name, you say his name is Adam, and you say, no, you say, is your name John? Then you throw it in, because sometimes, many times, they'll echo yes. I've noticed a lot of times the child will just say yes for everything. And basically, you don't get a no response, right? Then you can throw in another name and say, is your name John? And they're like, Then, before they say yes, they say, no, it's not. And then you go,
Not.
no. And right. And then
Right.
that kind of like,
Right.
just work on it. And I know it might seem like, oh, he just says yes to everything, but no, you know what? Slowly you will see. And especially I've noticed with with items which have high motivation, like maybe they like to play the iPad, and they big the iPad, and still with iPad say, are you done with the iPad? Yes or no? You know what? Trust me, you'll get a no response for
No.
sure.
That's so
So, you
that's
know,
totally that's so true.
so, you may think, oh, he says yes for everything, but no, use a high motivation object. So, just, don't give up on yes, no's, because I
Right,
think it's
right.
very important.
Yeah,
Also,
yeah.
basic signing, yes, no's, just pointing to objects, or even grouping for the other younger kids, right? Having similar objects, maybe fruits and vegetables, or fruits and toys, or whatever it is, then have them they group. They're playing a game of grouping. It's not like therapy as such. Sit down and play a game. Let's put them all together in stacks. As you're playing, putting in stacks. Oh, these are all fruits. Good job. You got all the fruits together. Or even colors, grouping by colors. All those are fun activities to do, and also increase not only just cognition, you're talking to them as you're doing this. Okay, this is a fruit, and this is, color is apple. The apple is red in color. Let's put the apple here. It's a fruit, like whatever. And then toys is a car, it's a toy. So you kind of, you keep talking to them, and as you're doing these activities, and all that is good cognitively for speech, and also the fact that attention, right? The fact that they're sitting and they're able to focus on the activity and doing for this long is a great win. Every time they do this, praise them. Don't be stingy about verbal praise, or even the reinforcing, with an usually food seems to be a big reinforcer for many, including me too, actually. So, so it will work. It doesn't matter, young or old. Food is a good reinforcer, right?
Right, yeah.
So you can use that, use
Yeah.
it in small doses. Yeah.
Right,
So, I
definitely.
mean,
Yeah. So, um, as a therapist, having worked with in this field for this long, what are some thoughts that you want to share with parents who are like, you know, for some children they evolve, their speech emerges and it comes out comes starts emerging at an early stage of therapy, but for some it seems like a very long journey. So what would you like to tell those parents, as they navigate this journey, helping their child to communicate?
yeah. Just, well, for some students, some children, it can just be hard. It can just be an uphill task for them to speak. However, I would say always use speech in conjunction with other modes of communication. So in terms of, so again, communication should not just be limited to speech. If the speech comes, good. You're modeling it throughout. You're, giving them the model, right? But if it doesn't, they should at least be able to communicate. But you don't feel disheartened, okay? Because again, is the individual able to communicate? That should be the key, right? For some, it does take longer to click, for them to actually get the pieces in together, for them to, but keep at it, keep at it. Again, I would never say throw in the towel and say, you can't.
It's not going.
There's no
Yeah,
such thing like that, you know.
right,
Uh,
right.
Everybody has different skill sets. Some can, yes, some cannot. But again, even if they cannot, if you can give them a mode to communicate, that is a win.
Right, exactly. I totally agree. And I also wanted to ask you about, you started working online with the children since the pandemic, right? So what has been your experience working with individuals online, giving
Yeah.
therapy sessions
So
online?
yeah. So actually, I worked with children both in preschool, first, second grade, and also with, right now I'm working with almost adults, right? Um, 16 to 18, 21, 22-year-old. The thing is, it has different challenges. But the good, I want to say the good first. The good is when you're working with children or with adults online, there's usually somebody with them. When I was working with preschool, at that time it was like full blown pandemic. So they were not even going to school, they were at home. So they usually had either the parent or a caregiver or grandma or somebody at home with them. So almost like they have to be involved, right? They're actually, they were actually part of therapy. Many times the parent is sitting right next to the child, or they seeing what we're doing, how we are facilitating communication, how that is great. I don't have to have a different parent conference to kind of explain this to the parent, right? They're seeing what I'm doing, or they can incorporate that. Right now I'm working because the school district I work for is at a further out distance from where I live. So I'm actually working remotely, but there they have paras and even teachers. Many times the teachers sit with the students, and so again, they're able to assist the student, and they can be a better carryover in the classroom. And because they're actually seeing me do, versus before I would have to pull them out if I'm in person, to
Right.
go to a different classroom, and maybe the
Right.
parent would come based on the
Right.
child, student. But now I feel that that's a good. And of course, the bad being, yes, there are some individuals for whom
Mm.
in person may be much more better than
Mm.
online. And these
Right.
may be individuals with maybe a lot of behavioral
Mm.
deficits who, can sit in front of a computer, or who get easily distracted, or or who show signs of aggression, or for them maybe in person may be better. uh but as we have to evolve with the times,
Right.
and
Right.
again, each student is different. I've I've had mixed experience with both. For some, it's great. I've seen students who were actually only using augmentative devices mainly. Now they're using speech
Mm.
for the most part, and using augmentative device to just augment the speech versus the
Oh.
other way around. And again, there's some who are actually gotten better using the augmentative device. So not to say that speaking speech, using speech is much more superior than not. Some are actually using augmentative device better. They're using sentences, they're using phrases, that kind of thing to express themselves. Um, but the thing though, I want to add is the expectations, right? Can we talk a little bit about that too,
Sure.
Meenakshi?
Sure. Sure.
Yeah,
Definitely. Yeah. Yeah.
because expectations of
Mm.
parents or caregivers, right, going into this is really important that we want to discuss. um you know it's like, if you look at it, right, it's like the whole picture is seems very daunting, right? How do I start? It's so much to do, and there's so many deficits that we need to work on, right? However, if we kind of tackle like one chip at a little bit at a time, right, then slowly it starts emerging, like maybe a sculpture, like a sculptor would sculpt, right?
Right.
Slowly you start the clay, you start chipping away at it, chipping away, and slowly maybe a flower or whatever deity that you're making comes out of it, right? The same thing with autism or like any other thing, right? It's a daunting thing if you look at it as a whole, but then you slowly chip away. But again, important thing is to know, what are you have your expectations reasonable and realistic expectations, right? If your child is, say, verbal, but not able to really express himself except with maybe echoing, verbal, maybe still verbal but just echoing words, but that's not communication, right? So what should the expectation of the parent be? Is to do algebra? No. To do, so it should be, how can their person communicate, right? Can he
Right.
talk basic communication? Can he get his basic needs met? Can he talk, respond to WH questions? Those should be the goal. That should be the goal. With WH questions, can you maintain a simple communication? Yes. Can you express your needs? Yes. That should be the goal, maybe for the short term. I'm not saying that is a long term goal, but at least get there, right? uh, and also realize the role that you are playing also in it, right? I've had some in the past, like the parents would bring the child and they would say, this is a male child, you know we don't make him to sit or do anything, like he rules. I'm like, well, if you're coming with that attitude for therapy and expect half an hour or 45 minutes of what I do to make a big difference in this child's life, it will not actually, because there's no way, if you're not going to follow up with it or do what you can at home based on what I'm telling you. No. So, just paying somebody to do the job is not enough, right? It has to be translated to things. Are you doing what we are telling you to do at home? Is it being reinforced enough times at home? I know it's a lot of onus on the parents to do. I know you're already overwhelmed. I know with a lot of things, but yet it has to be done in maybe in a playful way, and incorporated into everyday life. Doesn't have to be like, oh, table and chair time, therapy time. No, make it fun. Maybe read a book. Use whatever that you've been taught in therapy session in everyday routine. Yeah.
Right. 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 Totally agree with you. I'm glad you shared that. And any final thoughts, comments that before we wrap up, Raji? Anything from you?
Like I for one, I have mainly worked mainly with adults for the most part, and I just changed to working with kids just briefly over the past few years. And then, and I was so glad that I had this opportunity to work. It has opened my eyes to a lot of things. I learn a lot from my students, from the parents, you know and their perspectives. And also what is important in life. It has taught a lot to me as
Mm,
to what is the main essence of, is it important to know the ing marker? Is it
mm,
important to know the colors? Is it important? No, that's not really important, right? Is the grammar the most important thing? No. Certain things are stressed, I think. But I think the most important thing is to communicate. And
mm,
can you express your feelings? Can you
mm,
express what you want? Those are the most important things.
mm,
And I've learned a lot,
mm,
like I said, and it has been a privilege and an honor to
mm,
work
mm,
with individuals on this spectrum,
mm,
autism spectrum disorder, and to work with the parents. And unless we work hand in hand with
mm,
each other and support each other, we can help
mm,
in the best way possible. And also the team. The team
mm,
is very important. So please,
mm,
reach out to the team and
mm,
maintain a good communication with your team to get the best out of it. That is the main takeout from here.
mm, mm. Awesome. Beautifully said, Raji. Thank you so much. This has been a very interesting and an enlightening conversation. It's a pleasure, doing this with you. Thank you so much.
Thank you so much, Meenakshi.
Thank you,
Thank you.
Raji. Thank you.
Bye,
Bye.
everybody.
Bye.